Welcome everyone to the 12th annual Prostate Cancer Awareness Day. Usually it takes place at the State House. Now in the time of COVID pandemic, we are here virtually. It was very nice for me to see many familiar names among the people who participate in this event. Some of you who are new, it is great to have you. Some of you who participated in this event in the past, welcome back. It's a great pleasure for me right now to introduce my co-MC, Cheryl Bartlett, who is CEO of Greater New Bedford Community Health Center and former commissioner of the Massachusetts Department of Public Health. Cheryl, please.
Thank you, Faye, and thank you for inviting me to join you in this event again. I was there for the first one. I think I've been to all but one of them. And this has been a really important public health issue for me as a professional nurse and as a public health leader to address one of the most significant health issues that impact men in not only my region, the state, and the nation. And it's been a pleasure to learn so much alongside Dr. Stern about how we can do better with diagnosing and treating men for prostate cancer. So thank you, and thank you all for attending today, and wish we could all be together in person. So I'm going to be introducing Garth Greenman, and Garth is the Secretary and Treasurer of the Board of Directors for the Massachusetts Prostate Cancer Coalition. He has been a very strong advocate and voice for prostate cancer education, awareness, prevention, and treatment. And I believe he'll be joining us by video this morning. But Garth, thank you for all that you do, and thank you for being a great partner to AdMeTech and Dr. Stern and myself in this work and journey.
That all of us in the prostate cancer fighting community receive from the state of Massachusetts. So once again, thank you to Governor Baker and to all state officials for your work on this cause. Ordinarily, PCAD is in the grand staircase at the Massachusetts State House. It is an awesome setting filled with history as well as the normal continuous stream of daily legislative functions. For those of you who haven't been there, the buzz of activity is loud and constant, which often makes it a bit hard to accurately hear the comments that are being made. In our new world of Zoom, we miss the people-to-people connections, but it sure will be easier for all of you to hear about the deep resources that are available to help prostate cancer victims and their families. Our organization, MPCC, is delighted to be part of this team. I'm now going to share my screen with the home landing page of our organization's website. We have worked hard to make this site a deep source of information that is being constantly updated for everyone in the prostate cancer community to find resources, make connections, and seek support for themselves and their loved ones. Here's a quick summary of information about us. First, our mission is to educate, connect, and support men at risk, as well as newly diagnosed individuals, survivors, and their families. We also work to connect organizations and professionals in Massachusetts that seek to conquer and cure prostate cancer. You will hear much today about facts regarding prostate cancers. So in a short summary, it's the second most common cancer diagnosed in men after skin cancer. Sadly, it disproportionately impacts men of color, which is why reaching this community is an important goal for MPCC. Other things to note about us are, we were organized more than 20 years ago as a not-for-profit organization. The board members are all volunteers, and importantly, most of us are long-term survivors of this disease. And we have doctors on our board, as well as a distinguished medical advisory committee that keeps us well briefed on all developments in the fight against prostate cancer. Now I'm going to use the landing page of our website to quickly walk you through everything that we are doing. The green block leads us to the registration page for our annual symposium, which will be held this year on May the 14th. COVID forced us to be virtual last year, and the same will be true this coming May. Our symposium is our signature event and is designed to provide accurate and up-to-date information on prostate cancer diagnosis, treatment, and related research. This year, we are expecting more than 350 attendees and expect to again present educational sessions led by leading physicians, researchers, and healthcare providers. The virtual format enables us to admit any interested person to any of the presentations they wish to attend. We urge anyone who may be interested to register with us as soon as possible so you can electronically receive the full program details when they are available. There is no charge for this service, so you really have no excuse not to join us. The purple listen icon will lead you to links to access the digital media that we regularly produce. We have worked hard this year to keep expanding this resource, and interestingly, we have listeners from as far away as Australia. Please scroll through the rich subjects you will find and return regularly to see what is being posted. Pay special attention to our podcasts, which have become a very good way to share information. Next is our orange subscribe icon, where we invite you to give us your contact information so we can send you information in the future about what we are doing. We are always learning new information, and using our website has become a very efficient way for us to share it. We also ask that you consider becoming a member of MPCC and making a contribution at any level that is comfortable for you to help us support the continuation of our activities. Lastly, you will see behind the blue icon our curated list of the many support groups around the state who are pleased to help anyone impacted by prostate cancer to cope with the issues it presents. I want to especially note that we have a number of spouses of prostate cancer patients who are very active in our network, including leadership of support groups. Please reach out and make these connections if you need help or just someone to talk to. No one needs to be alone while they're fighting this disease. I know the PCAD program needs to keep moving along, so I want to thank you for your time and attention today. We at MPCC are very glad to be part of the prostate cancer fighting community and want to do whatever we can to help all patients successfully address their disease. Treating prostate cancer has come a long way since I was diagnosed in 2003, and today's new patients have many options to consider for treatment. Please reach out for help as you consider your choices. And once again, thank you to Dr. Stern for inviting us to participate in this event. Thank you very much.
Thank you so much to Garth Greiman of MPCC. I would like, before I will introduce the next speaker, I would like to acknowledge legislative officers who joined us, Representative Mira and his office, Senator Timothy, Senator Fatman and their offices, Representative Kane, Senator Brady, Representative Haggerty, Representative Brad Jones, Representative Fernandez, Representative Giannino. Thank you so much for joining us today. Our next speaker is Lamont Scott, Al Huber, and Hank Douglas, who lead Men of Color Health Awareness. This organization is serving underprivileged communities of Greater Springfield. Lamont Scott, please. Lamont will be also joining us by video.
Local plan says, my community is in need of me, it's in need of my fatherhood and my brotherhood. I pledge to be present. My presence depends on my health. My community depends on me. I pledge to be healthy in mind, body, spirit, and relationship. I will foster this in my family, and I will carry this in my community. MOCA.
Good afternoon. My name is Lamont Scott. I am the MOCA Project Director for Men of Color Health and Awareness. And I've been part of MOCA for the last 11 years. And I'd like to introduce some very, very special men that's been part of MOCA, on the MOCA movement with me for the last 10 years. So would you like to introduce them?
My name is Brother Al. I'm part of MOCA. I came along like 2011, seen 100 men on the steps of City Hall, and I wanted to be a part of this movement of staying healthy. I became a participant. Then I took the MOCA class. I took the MOCA facilitation course, and now I'm a facilitator for MOCA.
Hi, my name is Hank Douglas. I'm also a MOCA mentor with this program. I've been around for a few years also with these guys. I just was impressed that, we had an organization that was looking out for the health of Black people and Black men in general, because we go through such a mistrust with the healthcare system and doctors that it was actually the disparities were, the rates of disparities of death was so high that we wanted to make a difference and bring those numbers down. Okay, thank you very much.
Yes, I'd like to elaborate a little bit on that also. Hank brought a very good piece up that when we got introduced to the prostate cancer through Dr. Sanford James, we went up to the State House Boston. What he did is help us educate ourselves, also gave us the opportunity to come back to Springfield and start to educate other men within our community pertaining to this horrible disease that kills Afro-American men 2 to 3 times faster than it does any other race. So we had a concern about that, and also our concern was in Springfield. So with that, what we took forth was we took a pledge, we took an oath through MOCA to fight health disparities was in our community, but also we had interests around the state and also to be educated. And with that, some of the work that we've been doing, I'll let these guys elaborate. I'll send it to Brother Hank, and then Brother Al will elaborate. Some of the work that we've done around the community pertaining to prostate cancer awareness that we think is very significant to our community. Brother Hank?
Yes, how you doing? I'm also a community health worker that works for Bay State Mason Square Neighborhood Health Center, and I did this training through Holyoke Community College for community health workers. I went to a grant through Martin Luther King Family Services to become a community health worker with Bay State, and it was for a year, and they ended up hiring me full time. Now I work with people that have diabetes, heart disease, most of the things that affect people of color quicker than other races. And I'm trying to make a difference just in my neighborhood where I'm working at. We do focus groups up there where we have anywhere between 10 to 15 guys coming in on a day, and we talk about some of the things that we're talking about right now, as far as reducing disparities, exercise, eating right, paying attention to your health, and getting the primary care physician. A lot of us still have that mistrust from doctors from years years ago, back when Tuskegee did their project with Black men and give them syphilis and stuff like that. But anyway, that's some of the things that we do in the community. We also work with a lot of other community agencies that are doing things that are similar to us. Maybe one of these other guys can elaborate on that.
Sure, I will. Once for all, Lamont brought up Stanford James, and Dr. Stern had got a nice relationship with one another, and we collaborated with MOCA down here in the community because MOCA was developed to empower the men of color in Greater Springfield to eliminate the tools of disparity, and prostate cancer was a disparity in our community where men were not being checked. So the collaboration with MOCA and AdMeTech was very important in these years before the pandemic, because we was able to get out in our community to talk to men and let them know that one in 9 American men had this disease, and how do we bring quality information to the community for men to go to the doctor? So AdMeTech collaboration with MOCA was a very important movement. It's very important to let men know that that prostate cancer is still killing us in this pandemic, and we still need to go to the doctors. We still need to be checked because it's a real silent killer right now, even though we have a pandemic in America. So the work with AdMeTech and MOCA was a very important movement, and it still is.
Thank you, Brother Al. I'd just like to elaborate a little bit some of the work that we was doing pertaining to prostate cancer. And what we did, we took some information from we also like to speak on Dr. David Buchanan, who was also a good part of our work to help us process some of the information that we needed, and also have a great relationship with Dr. Stearns. He's from UMass. But also, what we learned from this, that we got some information that we brought to our community, and it was to take charge of your prostate cancer health. And what we wanted to do is get that information. What we really wanted to do is to put it in layman's terms, where men of color, in the way we talk in our community, and at the barbershops, and in the community, and then when we're around the house watching basketball games and things that we do, we wanted to bring up some very important issues, and also be able to talk to men so that we can talk about this horrible disease that's been affecting men for years. Now that we know there's a lot of new technology, we're trying to also rebuild that. We understand that when we hear the doctor terms, it's very hard for men to understand some of the language they speak. So what we did, we took it on our own to kind of revise some of that and break it down so that men would open up and talk about what they can do about prostate cancer, where they can go about prostate cancer, and then also some of the signs of it, and also to go get checked, because once we know that men are over 40 years old, especially in Afro-American and Black and brown community, that we have a high rate of prostate cancer that affects us. So we would give an opportunity to work throughout Springfield for the last 3 or 4 years, and go out and do some of these classes at Mason Square Health Center that Hank spoke about. That really, it gave us an opportunity to continue the work that we're doing today. Now that we see that now that this pandemic had came up, it has kind of, as Brother Al said, kind of backed us up a little bit, but the work doesn't stop. We still want men to go to the doctor. We still want to find the information that we can continue to get out into the community. We still want to focus on what's first, especially in our Black and brown community, because we know that we need to take care of ourselves, and we want to be on our families to also show them that that we don't have to go through all these other issues, and not be afraid to go to the doctor as men, especially Afro-American men and men, Black and brown men throughout our community. So that's the one piece that I would really like to emphasize. And we're grateful that we've had the opportunity to keep sharing the work that we're doing, not only through prostate cancer, but the work that MOCA continue to do to focus on the health disparities of men of color, Black and brown men that are not going to the doctor, and we're going to continue to push. So I want to say thank you for allowing us for this few minutes to talk a little bit about. We really want to be at the State House. We know we can't, but this is another avenue that we're learning to virtually, which is also allowing us to get the word out pertaining to prostate cancer, men's health, MOCA, and the work that we'll continue to do in our community. Thank you.
Thank you so much. I would like to, before I will turn the floor to Cheryl, I would like to acknowledge a couple of legislators and their offices who are present right now, Senator Bancori's office and Representative Kimmel's office. Thank you for being here. Cheryl?
Great, thank you. And a big shout out to my friends at MOCA. I was, when I was the chronic disease director for the Department of Public Health and the chairman of the statewide cancer advisory committee, we came up with the need around men of color as a top priority for the work that we were doing. And we kind of gave an open book to each community to identify how they could best address educating men, increasing awareness, getting them tested and treated early, and getting the best outcomes. And MOCA has really done an outstanding job of mobilizing the community. So great work. We started that in 2009. So 12 years later, you're still growing strong. Very exciting. And now we have the opportunity to introduce you to another community activist and educator, and that is Lovo Kalego. I'm sorry if I'm misspelling that, but he's the founder of the Community Health Awareness Network, serving immigrants from Africa with a focus on the Worcester area. So thank you for being with us here today, and we look forward to hearing from you.
I am the founder of Community Health Awareness Network. Community Health Awareness Network was established in 2018. Our mission is very simple. Basically, we want to empower and strengthen the immigrant community through health awareness. and access to quality, competent, comprehensive, and culturally sensitive care. So we're mostly outreach based. We do a lot of outreach in the community as far as disease conditions that are prevalent within the community. And for now, the pandemic, we have been doing more with the COVID-19, educating members of the community on preventative measures. And with the vaccine that is coming out now, we are advocating for community members to be able to get the vaccine, but also in the same process, educating members of the community on the importance of receiving the vaccine, why we think it's important for members of the community to get the vaccine. So, I mean, that just simplifies our mission. Our vision is to basically see a community that is able or is knowledgeable of what's going on as far as disease conditions and be able to make informed decisions. As such, with the COVID vaccine right now, we provide the information that members of the community need to just help them make decisions, whether right now in regards to COVID, whether they want to choose to take the vaccine or not. So that is our vision. So our motto basically is know better, believe better. So we feel that knowledge is power. So the more you know, the more you're apt to make better decisions concerning your life or concerning any situations that you're faced with. Our goals are to empower members of the community with knowledge that are prevalent or knowledge that are knowledge on prevalent health conditions that will help them make informed decisions concerning their health and their care, to provide health education and information on prevention, treatment, care, and support on diagnosis, to provide education and training that will equip members of the immigrant community with the right and appropriate skill sets and tools that will enable them to provide a comprehensive and culturally sensitive driven care, more like capacity building. And we also, our goal is also to provide education that will enable healthcare providers to become sensitive and educated on cultural competency of the community they're serving, and to also serve as a resource hub within the community where members of the community can come to us for information that they need, and we can make resources available to them to also increase health literacy of the African immigrant population. Coming from Africa, I know when I got here, there was a lot of things that I did not know. But now that I have the mindset, I'm able to impact lives in the community. So with this organization, we're able to work with clergymen, we're able to work with churches because we know there where the immigrant population gather the most in the churches. So we usually work with the churches, the pastoral board of the churches. We work with local organizations. We work with cultural groups. We just work with very much grassroots organization that bring the community members together. And our last goal on here is to educate to increase access to care through community partnership like what we have now with AdMeTech, because AdMeTech provide, one of AdMeTech goals is to do a campaign in the community where, relating to prostate cancer. And living in Worcester, 21% of the population in Worcester is African immigrant. And it is not just all females. We know that in Worcester carry one of the highest rate of prostate cancer within the immigrant population. So working with AdMeTech has been very, effective. It's been very great because we are able to use the resources. We're able to partner with them in using the resources to educate members of the community. So we're able to bring that kind of resource to the community. And this is what the community stands for. So being a part of the Prostate Cancer Awareness Council have just opened even more doors for the community members to receive the information they need relating to prostate cancer. So this is what Community Health Awareness Network stands for. The immigrant community is very diverse and is growing either by birth or by migration. So just making sure that community members are safe, they are healthy, and they're able to make informed decisions because we have information available to them is then just the goal for this organization. So if you're in the Massachusetts Worcester area and you are looking for a grassroots organization to connect with in working with members of the immigrant community, Community Health Awareness Network is here. We are located at 114 Endicott Street, 2 Worcester, Massachusetts. You can reach us at 774-253-0534, and that is our phone number. Or you can email us at info@chainglobal.org. That is info@chainglobal.org. And you can also find us on www.chainglobal.org. And that is our website, chainglobal.org. You can search us up too on Facebook, and it's Community Health Awareness Network. We are also on Instagram, and you can find us too on WhatsApp. So thank you so much for listening. You have a blessed day.
Thank you so much, Lova. Before we will proceed to the formal program, I would like to acknowledge Representative Oliveira and his office, and Senator Kennedy and his office, who are present at this event. Thank you for being here. Cheryl, the floor is yours.
Great. So do we have our guest of honor, Governor Baker, ready?
Yes,
He is here. Great. Are we having him or just a video? Do we have?
He said the video.
Okay, great. Well, first I want to shout out the Worcester folks too. They were part of the early Men of Color work that we did in the Department of Public Health. So glad to see that work continues and great leadership. And now it's my honor to introduce Governor Charles Baker, who is giving our opening remarks for the formal program. Governor Baker has been a very strong advocate and supporter of the work of AdMeTech and Dr. Stern. And we're really pleased that he was able to send some remarks to us today and able to actually make a video given all of the work he has his hands full every day dealing with the COVID-19 pandemic. Thank you, Governor Baker.
Good morning, and this is Massachusetts Governor Charlie Baker, and I'd like to welcome everyone to this celebration of the 12th Annual Prostate Cancer Awareness Day, dedicated this year to Black History Month and Naacp Vaisakhi, a prostate cancer warrior. Thank you to AdMeTech Foundation for inviting me to participate once again in this important chance to raise awareness about prostate cancer here in our Commonwealth. In Massachusetts, we're proud to lead the nation in recognizing prostate cancer as a public health priority and as a persistent disparity faced by people of color. As we celebrate Black History Month, I'm glad to have this opportunity to stand together and raise awareness of this continued challenge. I'd like to extend my gratitude to the legislators who have worked in partnership with our administration to treat the threat of prostate cancer with the urgency it requires. And I'm also thankful to the leaders of our world-renowned research hospitals, the American Cancer Society, the NAACP, and other members of the Prostate Cancer Action Council for working with AdMeTech to create and expand the Massachusetts model as a national leader in prostate cancer research, education, and public awareness. These are the best weapons we have in the battle for improved prevention, patient care, and the elimination of public health disparities. I'd also like to acknowledge the prostate cancer survivors who will share their stories as part of today's program. They serve as an example for so many men in our country and the Commonwealth by having the courage to speak up about their experience with this disease and the generosity to transform their struggles into public service. We all thank you for your bravery. And despite our best efforts and the fact that prostate cancer is in fact curable when detected early, the American Cancer Society projects that 690 men in Massachusetts will die from this disease in 2021. That's far too many, and I look forward to working together with all of you to raise awareness, fund research, and save lives. And today, I'm proud to declare February 25th, 2021 as Prostate Cancer Awareness Day here in Massachusetts. And as we celebrate today, I call upon all of you and our world-renowned universities, hospitals, and other organizations to join us in our commitment to making Massachusetts a national leader in prostate cancer research and care. Together, we can tackle health disparities and make sure our families and communities will never again have to grieve for another father, brother, or son lost to prostate cancer. Thank you. I hope you enjoy the rest of the program.
Thank you, Governor Baker.
It is a great pleasure for me to introduce Speaker of the House, Ronald Mariano, who have been supporting prostate cancer awareness for many years. Speaker Mariano, please.
Hello, I'm Ron Mariano. I'm honored to be here today virtually on the 12th Prostate Cancer Awareness Day. I want to thank the AdMeTech Foundation for the invitation and a special thanks to Dr. Stern and Cheryl Bartlett, our hosts for today. I'm looking forward to the day when COVID-19 is behind us and we can have the event back at the State House. The COVID-19 pandemic has shed light on the deep-rooted health discrepancies that have existed within our communities for a very long time. AdMeTech, through its advocacy work in events like this, has recognized the disproportionate impact of chronic diseases on people of color. They have made it their mission to address it. Prostate cancer is still a deadly disease, but one that can be cured when detected and treated early. Awareness, education, and research are the keys to improving people's health outcomes. That's why the Massachusetts legislature has been proud to annually support the work of AdMeTech in its education and outreach work. For Black and Latin men, men with a family history of prostate cancer, and others of high risk. All of us have the responsibility to talk with our doctors about getting screened for prostate cancer. If you don't have a primary care doctor to talk to, please get one today. For many years, the legislature has recognized prostate cancer as a public health priority, and we remain committed to continuing the work. Thank you.
Thank you, Mr. Speaker, and congratulations. A great choice to help lead our state.
It is my pleasure to introduce hosts of this event, Senator President Pro Tempore William Brownsberger, House Majority Leader Claire Cornyn, and Representative Gerald Cassidy. Will, would you like to start?
Sure. Thank you so much. You know, I'm just very glad to be part of this event, especially because we're remembering your father, Naacp Visacki. Naacp was someone very special to me. I got to know him for the last 7-8 years of his long and extraordinary life. Someone who survived Stalin in Russia and just World War II and went on to do so much good for so many people. A prostate cancer survivor himself, but somebody who just carved out a very unique and special role in Brighton and in the community of immigrants more broadly, Russian immigrants more broadly, doing enormous service to a huge range of people from that community who were in need, immigration help, healthcare help. He found a way to channel resources to them and give them what they needed. So he's just an extraordinary human being. And I'm very pleased to be honoring him with you today. And I'm also just so grateful for the work that you do, Faye. You've really followed in his footsteps. I mean, your pioneering work on the MRI technique of identifying prostate cancer, as opposed to the barbaric sort of biopsy, slice it up approach that was the, or still is done to some extent. Very significant. And one of the things that you've taught me is the significance of, it's one thing to sort of have an idea from a research standpoint and to try to get it out there, but what you really need to do is, in fact, advocate for it and get the funding. You have to drive the advocacy through the political process so that the scientists will turn around and actually focus on it and do the trials that are needed to really validate a technique and get it out there. And of course, in fact, to do the public health work, to get people to get the screenings once they're available. And so your work, I think, very much continues the work of your father in the sense of making sure that people in need are well taken care of and not ignored. And so thank you for what you're doing. Thank you for doing this day every year and for all the work you do in between. And I'm just glad to be part of it. And I guess I turn it over now to my co-host, Rep. Jerry Cassidy.
Then we will proceed with House Majority Leader, Representative Cronin.
Good morning.
Sorry for the technical difficulties.
Good morning. Can you hear me?
Yes, we can.
Okay, terrific. Good morning, Faye. It's great to see you here today. And I just want to thank you one more time for all the wonderful work that you have done on behalf of AdMeTech and prostate cancer research and treatment, and also to the help that you have provided to some of the most vulnerable members of the people in my community in particular. I want to give a big shout out to my colleagues from the legislature and also Cheryl Bartlett. So good to see you here today. The work of AdMeTech is really been demonstrable in my community. I first got involved with Dr. Stern and AdMeTech and prostate cancer awareness as a result of the work that my local Brockton NAACP was doing with AdMeTech. We've continued to build the program that we have had in Brockton. We started, I remember several years back, having an event with maybe 10, 12 people. It has just exploded since then. We actually have people who have attended our events in Brockton that as a result of the event got screened, and we had 2 people I know of that saw their doctor and were screened based on what they heard at the AdMeTech event. And both of them were diagnosed with prostate cancer. Had they not been at the event, they probably wouldn't have had the screening, but because of that, they were detected early and their prognosis is quite good. So the evidence is there that early detection matters. Early detection saves lives. And so I will continue along with my Brockton Representative Jerry Cassidy, who you'll hear from soon, and we will continue this work and look forward to working with all of you. And you're doing great work. Keep at it. Thanks.
And congratulations to you, Madam Majority Leader. Very proud of you.
Thank you very much.
Thank you so much. Jerry Cassidy, would you mind providing a few comments? And before we will proceed, I really want to thank Claire and Jerry and Will and everyone here for your championship of our program and our ability to do research, education, and awareness in Massachusetts.
Thank you, Doctor, and thank you very much for your advocacy. Senator Brownsberger, I tell you, did a phenomenal job. I can't do much more than what he said, especially about your father, Doctor. I know how much he was loved and honored by so many throughout Massachusetts, and of course my good colleague, Majority Leader Cronin. I love saying that name now, Majority Leader.
Yeah, it's great.
Thank you. But Senator Brownsberger was correct. We can't do this without the funding. In the last few years, I've been working on getting the funding to bring prostate cancer awareness here to Brockton and throughout the state. I know you've advocated throughout the whole city. And we do have a resolution presented to you. I know Senator Brownsberger and I have been working on that. So thank you very much, Doctor, for everything you do.
Unmute. Oh, here's the unmute. Okay.
I think we have Senator Cream, Majority Leader of the Senate. Thank you for joining us today.
Thank you. I am so sorry. I could not, there was no button for unmute until the host just sent me one. So I apologize. I heard my name 3 times and I said, I'm here. So I'm sorry if I held this all up. Thank you so much. I want to thank Dr. Stern, who is tireless. She is a wonderful, you could not have picked a more committed advocate for the issue of prostate cancer, front and center. Everyone knows in the legislature when they see her exactly what her issue is, and we're so proud of her. And it's a testament to your mission to find the best evidence-driven treatment to help prostate cancer patients. So many legislators have turned out here and supported, and I want you to know that's very unusual to have so many people. And it's noteworthy that you're moving our state's healthcare toward the goal of eliminating racial and ethnic disparities in awareness of this awful disease, which can now result in unacceptable racial and ethnic disparities in diagnosis, treatment, and outcome for men with prostate cancer. Both the state, Senate, and the House have recognized the importance of this. On behalf of our parents, relatives, friends, and neighbors, we support you and your endeavors. Prevention and educational programs are part of the healthcare continuum that protects the public, and speaking up about prostate cancer has already resulted in successful outcomes. So again, we owe a debt of thanks to all of you for your really, really hard work. And we need to continue to fight together, work together, and walk together in order to fight this awful disease. Thank you again for asking me, and I apologize for my late entry. Thank you.
Oh, it's great to have you, and thank you for taking the time to join us today and your commitment. It's the commitment of the legislature that really has helped us to move the needle on this disease and improve diagnosis, treatment, and health impacts to the men of our state. Now I think Dr. Stern is going to talk to us a bit about the work she's doing at AdMeTech and that all of us are committed to supporting.
Actually, my presentation will need to wait. Thank you so much, Cheryl. I just got a note that Representative Santiago stopped by on his way to the hearing on COVID-19 situation in Massachusetts. And with your permission, I would like to, with great pleasure indeed, introduce Representative John Santiago, who is not only a vice chair of Committee on COVID-19 and Emergency Preparedness and Management. He is also a physician in Boston Medical Center who is on the front line fighting against COVID epidemic. Representative Santiago, please.
Great. Well, thank you, Dr. Stern, for the introduction. And I apologize for having to jump off in a couple of minutes that we had to a very important oversight hearing. But I just wanted to, so honored to be here with each and every one of you celebrating this very important day on this very important issue. Dr. Stern, I mean, you and I both share an interest in medicine and science. And I think we're very similar in the fact that we want to bring the stories of our patients, stories of our family members who've had issues with their health care to the State House. And I think, you've been doing that for a very long time, and I've been doing that for the past 2 years, and I think it's made a difference. Without a doubt, you've made a tremendous difference in prostate care, but understanding that there exists a whole host of disparities in prostate cancer, right? I think what we've seen in COVID-19 is that it's taken really off the lid off these inequities. It's exposed us to these inequities. They've been exacerbated by them. I think the work you're doing is so important each and every day, fighting for these patients. And it's been really an honor to partner with you, partner with the Majority Leader Cronin and Jerry Cassidy. When we took, I think one of the first COVID events we did was with NAACP in Brockton. And it was a great experience to educate folks, to let them know the importance of getting screened, particularly in communities of color. So I'm just very honored to be here to share in this event with you all, and look forward to supporting the efforts of AdMeTech moving forward. And just thank you again.
Great,
Thank you
thanks.
so much. Thank you. Okay, is Representative Williams here? Representative Bud Williams? Representative Gonzalez? Okay, then I think we can proceed with my brief presentation. It will describe, thank you for your introduction earlier, Cheryl, that will describe a statewide program that we designed, we manage, and we lead together with many other great organizations in the state of Massachusetts with support of Massachusetts legislature. Welcome again to the 12th Annual Prostate Cancer Awareness Day. We are honoring Black History Month and memory of Naacp, my father, who was a lifelong champion of the underprivileged, the immigrants, and the elderly in particular. This event is organized by AdMeTech Foundation in collaboration with members of the Prostate Cancer Action Council, American Cancer Society Cancer Action Network, Center for Elimination of Health and Social Inequities and Disparities, Community Health Awareness Network, Latino Health Insurance Program, Massachusetts Prostate Cancer Coalition, Men of Color Health Awareness, New England Area Conference of NAACP, and our independent Blue Ribbon expert panel consisting of the state leaders in clinical care and research. This event is an integral part of the statewide program that's created a Massachusetts model of national leadership in prostate cancer research, medical education, and public awareness. The priority focus of this program is on high-risk men, particularly African-American and Hispanic individuals, their caregivers, and physicians. Our program has three main components: public awareness, medical education, and research. Our public awareness efforts are focused on the most vulnerable and underserved communities. Early last year, we have realized that the areas of health disparities in prostate cancer overlap with hotspots of the COVID pandemic. Consequently, we expanded our education to include COVID prevention, diagnosis, and treatment. Together with members of the Prostate Cancer Action Council, we reached over 15,000 underprivileged individuals since January last year. We are in the midst of the pandemic and find it difficult to address prostate cancer awareness without addressing COVID-19, an immediate threat to lives and health. We have focused on what we as individuals can do to protect ourselves, our families, and our communities and end this pandemic. Social distancing, protecting our face, hands, eyes, choosing outdoor instead of indoor activities, getting ready to be vaccinated. In particular, we addressed hesitancy related to masks and vaccines. The best recent predictions indicate that universal masks alone can save over 40,000 American lives and prevent infections in millions of people by June 1, 2021. The ultimate goal is to have publicly available vaccines. Current evidence indicate that Pfizer and Moderna vaccines are safe and highly effective at preventing symptoms, hospitalizations, severe disease, and death in millions of people. Other vaccines, J&J, AstraZeneca, Novavax, show considerable promise and may become available within the next few months. The global goal is to vaccinate billions of people. World Health Organization, with multiple partners, created COVAX facility for equitable vaccine distribution. As of July last year, they support over 165 countries and over 60% of world population. US national goal was articulated only last week by President Biden and Dr. Anthony Fauci, who announced there will be sufficient doses for 300 million Americans by July this year, with the aim to complete vaccinations by September. 2 months ago, President Biden joined former Presidents Obama, Bush, and Clinton in volunteering to be publicly vaccinated and reassure everyone that Pfizer and Moderna vaccines are safe. While we are dealing with COVID pandemic, prostate cancer cannot wait. Unfortunately, many men stopped visiting clinical facilities out of fear to contract coronavirus. And yet delays in care can cause reduced quality of life and even loss of life. It is important to highlight that clinical facilities created a safe environment for prostate cancer care, including telehealth for virtual visits, ongoing in-person care, and medical procedures, including biopsy and treatment. Delays in prostate cancer care are particularly unacceptable for Black men, who are 2.5 times more likely to die. Medical education is the second component of our program. Annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer took place virtually in October last year. Our summit has made a decisive impact on the state of the art and future vision for patient care. In October, we had 400 attendees. Our media partner, Grand Rounds in Urology, published summit presentations and escalated our educational impact, reaching over 15,000 prostate cancer providers internationally. Research represents the third component of our program. Joint research project of AdMeTech Foundation and University of Miami provided proof of concept for radiogenomics, integrating imaging with genetic analysis of cancer tissue. We have shown that MRI, when integrated with genetic cancer profiling, can arm physicians with a precise diagnostic information to optimize and individualize patient care. I would like to acknowledge our sponsors: gold sponsor, MIR Scientific; silver sponsors, Johnson, J&J, Pfizer, Sanofi Genzyme; bronze sponsors, Progenics, Lantheus, Sotio. We are proud that our sponsors are leading the battle against both prostate cancer and COVID-19. Lastly, I would like to thank our team, AdMeTech staff led by Thomas Satam, event management consultants led by Nancy Petkunas, and technical support led by Bill Windeknecht. Finally, I would like to invite everyone to our 5th Global Summit that will take place virtually in September this year. Thank you for your attention.
Thank you, Dr. Stern. It's always a pleasure to hear the latest updates from you and to take that home to our families and friends and share. So I think we may be a little ahead of schedule, and I don't see Senate Majority Whip Rush with us yet. So
Well, Cheryl, while we are waiting for Senator Rush and Representative Gonzalez and Representative Williams, may I please acknowledge several legislative offices present here right now. Representative Ruth Bolter and her staff, Representative Phillips, Representative Honan and his office. And I just got a note that Representative Williams just joined us.
Oh, great.
Representative Bud Williams is a great champion of both COVID-19 and prostate cancer awareness in Springfield. Representative Williams, do you mind unmuting yourself? Representative Willis, do you mind proceeding with your comments?
Okay, I didn't know you were ready for me. I'm here.
Yeah, we're a little early.
Man. You guys,
Being here.
you guys are quite, first of all, Dr. Stern, thank you for all the great work you and your folks do in terms of this prostate fight. And, you know, I work primarily with the men of Mocha in Springfield with Lamont and Bo and Henry Douglas and Ben Markham Jr. And it's quite amazing what you folks have done. And we're able to secure that nice grant from the state to begin working in the community. And I just tip my hat off to all of you for fighting in this dreaded disease and in the midst of a pandemic, which makes it doubly hard to really deal with it. So I just want to thank all of you for all of the hard work you do. Too many names to mention, but certainly I stand in the valley with you. We're not on the mountaintop on this issue. We're in the valley, and we work with those who are less fortunate, those who would seem to shy away from services. And that's one thing the pandemic has demonstrated, that the inequity that exists in healthcare. And you folks have been beating the drum for years. You haven't just started this issue, this mission. And certainly we'll stand with you to continue to provide the testing. And there's one, I want to underline one particular thing. There was a time when you could go for your physical at your doctor, and they would give you the prostate test. Now it's my understanding you have to request to have the test done, which is like, really? So I would hope that that's one issue I think we need to work on, and that's an internal policy thing, I believe. So certainly that's Dr. Stern, that's what I really want to work on, because when I met with them in the Mocha, we were doing, just before the pandemic and we really shut down, we were doing sessions in the community. The men of Mocha, we meet with 20, 25 individuals at a time, Black and brown men, and just give them the orientation, the information, and try to educate them. And that came out of a discussion that I know when I go to my doctor, I used to get the prostate, whether it's the PSA or the physical one or the blood. But certainly that's something we need to work on, because if they're not testing, screening basically, and you have to request, it's hard enough getting Black and brown men to come in to doctors. And when they get there, we're not going to give them full service. Well, so I don't want to end on a sour note, but just thank you for all the hard work that you do. I'll continue to support you on Beacon Hill locally and statewide. And Dr. Stern, I appreciate you, you and your staff, what you folks have done. So thank you.
Thank you for joining us in those comments. And you're so right. The U.S. Preventative Services Task Force unfortunately downgraded the recommendation for an annual PSA from the gold standard to basically saying it was in some ways dangerous for men to have, which created a lot of confusion in men and primary care providers. And so we kind of went to, the pendulum seems to always swing extremely. And so we stopped testing men for PSA in many cases. And now, as you say, you have to have an informed discussion with your provider to ask them to order that. And we know that that has had a negative impact on a number of men's health outcomes. So we're right there with you as this being a big priority to re-educate. The task force has upgraded the recommendation again. It's now, I think, like a C+ instead of an A to an F to a C+, suggesting that it does have benefit. And Dr. Stern and the work she does with precision diagnostics has really educated both the men and the providers and how important of a tool it is, and to begin the differential diagnosis of prostate cancer. So very important.
But just can I chime in real quick? I forgot. I want to do some house cleaning. I forgot to mention my main man out of Brockton, Representative Cassidy, who does a great job down there, and he really enlightened me on this issue when I first got to the State House. I just want to send kudos out to Representative Cassidy from out of Brockton. And I know how hard he works on this particular issue. Thank you.
Great. Thank you. Thank you. And next I see that we have the Senate Majority Whip on the line, Senator Mike Rush. Senator, it's great to see you. And thanks for joining us again. Your ongoing commitment and advocacy for prostate cancer education and awareness is really critical to the work that we do. So welcome.
Well, listen, it is great to be here this morning, and thank you, Cheryl, for all your work and advocacy, and always a pleasure to see you, and hoping all is well during these turbulent times here. But you know, we move forward. That's what we do, right. And that's what this is all about. Having this morning, it would be easy to just say, well, you know, we're in a global pandemic and things will run their course, but ultimately we persevere on the issues that affect us and the issues that are important to us. So it is a pleasure to be here this morning with you, and it is a pleasure to talk about this issue. This is an issue that needs to be talked about, and as we know, knowledge is power, period. Knowledge is power. And that's what it's about. People need to be listened to and also talked to about issues that affect them, their health, their families. As you and I have talked about over the years, we need a statewide program in prostate cancer research, education, awareness. You know, and those are really, to me, and we've had this conversation many times, the three main pieces here, but the conversation has to be ongoing and constant. So, you know, let's move forward and continue the great work that's being done. And, you know, as Representative Williams just said, and Representative Cassidy, and, you know, we're here to work in partnership with you to not only have the conversation, but then deliver the action needed to solve this crisis. And as we know, African-American men and Latinos are disproportionately way higher in terms of this just vicious disease. So we have an opportunity to work together. And as we know, again, knowledge is power. So we're here to stand with you and do the hard work necessary.
Thank you, Mr. Leader. And I think your point is well taken about it would be easy in a COVID pandemic to just sort of let this slide this year. And first of all, you know, Dr. Stern would never let that happen. She
no way. I see her right
every
now.
Day, every year, no matter what else is going on in our lives. And rightfully so, because what we've seen, I'm running the Greater New Bedford Community Health Center these days, and we've seen a lot of people drop their wellness visits, their screening visits, which means people are going to be more at risk for some of these diseases to really manifest themselves in a significant way once we kind of take our eyes off of COVID and remember that people have a lot of other health needs to be addressed in these times. So kudos to Dr. Stern for keeping her eye on the ball and the goal here. And again, thank you, Majority Leader. It's great to see you.
It is a pleasure to be here with you virtually. I like the in person better, obviously we all do, but it is a pleasure to be here with you and to work together to tackle this terrible disease. So thank you.
Rash, thank you so much for your support for years.
Thank you, Doctor.
So much for your absolutely critical support for our ability to do our job. I am told that we are running a little bit early, and I'm told Representative Gonzalez is not here yet. And I would like, it is a great pleasure for me to introduce Juan Caulfield, President of New England Area Conference of Naacp, member of our Prostate Cancer Action Council, and a great supporter of the prostate cancer cause and program in Massachusetts. Juan, please.
Thank you so much. I am pleased to be here this morning and a part of the program. Um, I want to say begin by expressing appreciation to Dr. Stern for the wonderful job that she has done as the founder and the president of AdMeTech. Um, I also want to say hello and express appreciation to the legislature, those who are and will others will make a presentation. Uh, my state senator, Mike Russ, a special hello to you.
Thank you, Mike. Great to see you. You look great.
Wonderful, wonderful. And I've gotten to know Representative Cassidy through his strong advocacy of this program. Representative Cassidy, thank you so much. This is well, first, the New England Area Conference is happy to have developed a relationship with Dr. Stern and AdMeTech over the years, and it has been consistent, and the relationship and the working with AdMeTech has grown between the two organizations. And it is so important to the New England Area Conference of the NAACP because it is one of the 5 advocacy game changers that the NAACP through the National Board has developed over time in a strategic plan. Addressing health issues and health disparities is one of those 5 game changers. And it's particularly important because, at least in the New England Area Conference, we are absolutely know and understand that we have the potential of making a difference here, as opposed to many of the other health disparities that are more difficult to address. With prostate cancer, as opposed to many of the other health disparities, such as hypertension, diabetes, and many other asthma and many others, it requires a lifestyle change or a change in your environment in the case of asthma. Addressing the problems of prostate cancer does not require a lifestyle change. Hypertension and diabetes requires that you, certainly for diabetes, that you exercise. Obesity or overweight and losing weight is a problem that must be addressed with hypertension. That does not exist with prostate cancer. It only requires that we spread the issue of awareness so that people become aware of prostate cancer and early detection. That's, again, an issue that does not require a lifestyle change, which is so difficult. And many of us who are overweight, we know how difficult it often is to make lifestyle changes. That's not the case here. It's awareness and education. The New England Area Conference has 15 active branches of the NAACP under its jurisdiction, ranging from the Berkshires all the way to the Martha's Vineyard branch. And we have been active in spreading the word and increasing awareness and asking our branches to work with us to increase awareness so that we can make the change that's necessary. I will also share with you that I'm a prostate cancer survivor, as a knock on wood. I learned very early. I had a doctor who was attentive to the issues of prostate cancer, but different from so many doctors, particularly at that time. I found out roughly in about the period of 1960. And at that time, even before the task force and its erroneous indication, of not distinguishing the really differences in demographics and age importance. But my doctor was very attentive, and he was testing me for prostate cancer with the PSA, and I didn't know anything about it. It was just another blood test to me. And he realized that my PSA was rising over time, and he sent me to a urologist, and that was the beginning of the process. And at that time, uh, the precision diagnostics was not available, and I got treated for prostate cancer, and that was in roughly 1960. Uh, and I am here today, and I'm sorry, that was 16 years ago. I'm here today and in reasonably good health. And Dr. Stern, I'll also tell you that I had my second coronavirus vaccine a couple of days ago.
Great.
Yes, but this is an important issue for the New England Area Conference of the NAACP. We are strong advocates for early detection, and for the early detection to come about, it requires having men become aware of the issue of prostate cancer and insisting. I say, and we tell folk that they ought to insist with their doctor that they get tested for prostate cancer with the PSA exam. It's an important advocacy issue for the New England Area Conference of the NAACP. We are pleased and proud to be partners with AdMeTech. We are also pleased and proud that the legislature and the executive office have been responsive to the request of AdMeTech, and the New England Area Conference has been working with AdMeTech, as I've said, but you've been responsive. We see that as being very helpful in contributing to better health for Massachusetts citizens. Thank you so much.
Thank you, Juan. Always great to see you and have your
Great to
voice
see you,
at the
Cheryl.
table.
Thank you.
And congratulations on getting vaccinated. It's a great feeling, especially after you get the second one. You kind of feel like, okay, there is hope here.
All righty.
And we are working in New Bedford to make sure all people have equal access to getting vaccinated, even though we might not be following the rules exactly. Don't tell anyone.
As long as you're getting it done. Thank you.
Getting it done. Any arm will do, I say, when we have a vaccine ready. And I'm pleased to follow up your comments with a friend and colleague of yours and ours, Steve Bernard. He's the immediate past president of the Brockton area branch of the NAACP. And Brockton, Dr. Stern and both myself have been to Brockton to do some education and awareness. So always happy to have your voice with us.
Steve Bernard's video, please.
Prostate cancer awareness and education that is saving the lives of our brothers in Brockton and throughout the Commonwealth of Massachusetts. Also to thank the many medical professionals who have contributed to the success of the Brockton prostate cancer events. Thanks also to the legislators of the Massachusetts Senate and House for supporting AdMeTech initiatives to create a state program in prostate education and awareness. My name is Steve Bernard. I'm the past president of the Brockton area NAACP. Our branch was established in 1954, 67 years ago. Our current president, Ms. Phyllis Ellis, and her administration are leading the Brockton branch to new heights of engagement and achievement in Brockton. The Brockton branch is a member of the New England Area Conference of NAACP branches. Members of the Brockton branch who attended an annual NAAC meeting in 2015 were shocked to learn from Dr. Boehner Stern, president of AdMeTech Foundation, and a keynote speaker on that day, that Plymouth County has among the highest mortality for prostate cancer in Massachusetts for all men, and the highest for Black men. What's worse, we learned that prostate cancer mortality in Brockton for all races is 30% higher than the state average. That prostate cancer mortality for white men in Brockton is 14.6% higher than the state average. But listen to this, prostate cancer mortality for Black men is 39% higher than the state average. Black men are 2.5 times more likely to die from prostate cancer. We learned on that day that prostate cancer is a crisis in the city of Brockton. Following the annual meeting in 2015, we partnered with AdMeTech Foundation and Good Samaritan Medical Center, having a priority focus on high-risk men in Brockton, that is men, Black men of African and Hispanic origin, men aged 50 years and older, and men with a family history of prostate cancer. To promote prostate cancer awareness and education, we have built a very strong team of advocates, including the partners, NAACP, AdMeTech, and Good Samaritan Medical Center, elected officials, including our Brockton Mayor, Robert Sullivan, Senators Michael Brady, Representatives Jerry Cassidy, Michelle Dubois, and Representatives Claire Cronin. We also built a very strong relationship with the Brockton Community Access television station. The partnership team includes Dr. Faina Stern of AdMeTech Foundation, Thomas Satham, Manager of Office Operations and Health Policy at AdMeTech, Phyllis Ellis, President of the Brockton area branch of the NAACP, Leona Martin, who is the second Vice President of the Brockton NAACP, Janet Trask, who is our Health Committee Chair, Lynn Cornelius, who is the Director of Marketing, Public Affairs, and Community Health at Good Samaritan Medical Center, Bishop Tony Branch, who is our first Vice President and is the host of our NAACP forum on Brockton Cable Access Television, and yours truly, Steve Bernard, past President of the NAACP. The partnership team plans and organizes prostate cancer awareness and education events. From January 2016 to present, we have held more than 12 prostate cancer awareness education forums. Held at both large and small venues, we have made a concentrated effort to address people in the comfort of their church or social gathering place. To this day, we remain vigilant to sustain the goal of ending the prostate cancer crisis in Brockton. We knew from the start that the challenge would be sometimes daunting. It is, however, encouraging to know that early detection saves lives. We encourage men at risk to take charge of their prostate care and their prostate health. Consult with their doctor beginning at age 40. During the COVID-19 pandemic, we have held 2 awareness and education events. The first was a virtual town hall titled Take Charge of Your Health, with an impressive group of speakers, including State Representative Jerry Cassidy, Brockton Mayor Robert Sullivan, NAACP President Phyllis Ellis, Dr. Richard Herman, who is the City of Brockton Pandemic Consultant, Ken Lawson, MD, and Chief Medical Officer at Good Samaritan Medical Center, and of course, Dr. Faina Stern, President of AdMeTech Foundation. This town hall was viewed by over 2,000 people. Our next event was held on June 28th. The partnership, the NAACP, AdMeTech, and the Good Samaritan put on an event that was presented, and it's entitled Virtual Education Event, Prostate Cancer Awareness in Times of COVID-19 Pandemic, Know Your Risks and Take Charge of Your Health. Distinguished speakers included Robert Sullivan, the Mayor of Brockton, State Representative Claire Cronin, the Reverend Houston Creighton of Lincoln Congregational Church, Brockton President Phyllis Ellis, Dr. Guy Fish, Dr. Riot Frankel, and of course, Dr. Faina Stern of the AdMeTech Foundation. Our next event will be held on March 21st of this year, 2021. Brockton is no longer one of the leading Massachusetts cities with one of the highest rates of prostate cancer deaths among African American men. This was not the case when we first started our prostate cancer awareness program 5 years ago. The Brockton NAACP is proud to have been a very active participant in helping to reverse this alarming trajectory. Thank you, AdMeTech, on this 12th annual Prostate Cancer Awareness Day.
Thank you very much, Steve. It's been really a privilege to work with New England Area Conference NAACP Juan Caulfield and with you, Steve, and with the Brockton team to make a significant difference in Brockton. Thank you for giving us this opportunity. I would like, before I will introduce the next speaker, I would like to acknowledge a couple of legislators and their offices who joined us, Representative Blaze and Representative McGonigal. Thank you. Thank you for your presence and your support. A great pleasure for me to introduce Dean Kenneth Elmore, Master of Education, JD, Associate Provost and Dean of Students, Boston University, and prostate cancer survivor. Dean Elmore, please.
Well, thank you, Thana. I appreciate being here, and thank you, Cheryl, as well. I know that we are listed, or I'm listed as a prostate cancer survivor. I am still in treatment, so I like to think that I am living with it, and that's an important piece. So I'm here to bear witness, and to bear witness, I think, to some important sorts of things and a story that makes it happen and come alive. I'm here to bear witness to the important process of being able to accept help, to ask questions, and to accept that this is the body that I have, and I've got to do the best to make sure that that's the piece that works for me and for everyone around me. And as we speak of everyone around me, how important community, family, and friends are in terms of working through this, dealing with this on a personal level, both large and small. My wife saved my life. I'm a firm believer in that, not just because she's my wife and she looks after me all the time, but because I had a doctor's appointment after I hadn't gone to the doctor for so long over a period of time, and I was going to skip it. I had other things to do. I was busy. My health and getting a checkup wasn't important to me. And I thought to myself, well, if I skip this appointment that my wife had set up for me, she's going to be pretty mad. And thank goodness I went to the doctor that day. I still remember that day when I went to the doctor. I went to the doctor and I found out on that day that there was probably something problematic, something wrong. And it was the start of my diagnosis of my prostate cancer. I also ended up having to get a series of treatments and we found out that I was at stage 4. So my wife saved my life, and that is very important. I also think that the other things that saved my life were the folks in the community who, once they found out that I had prostate cancer, came out to say, let me be supportive to you. Let me help you. I have also dealt with this as well. There are things you should be thinking about, ways that you should keep your mind together, and ways that you need to advocate for yourself as being very important. I had to make sure that I had some things that were important in my life, like more education, making sure that I looked at my diet, make sure I looked at my activity. And I've heard many people say lifestyle is an important sort of thing to think about so that you support yourself over the course of it. And of course, I had to really think hard about how I worked with my doctors and the kind of relationship that I had with them. Now, with the pandemic, as with so much of it, I'll admit I'm one of those folks who has not always had a great understanding of, even though I consider myself fairly educated, understanding or trust in the healthcare space. I come from South Carolina. I come from a family where Jim Crow still was in my life. I recall those sorts of things. And there was a deep distrust of institutions that unfortunately I carried into my professional life. I still have a little bit in the back of my head. And I say to any of you out there, especially men, especially Black and Latino men, Black and brown men, I know that it's hard sometimes for us to be in the vulnerable position that this sort of thing may put you in. I know it's difficult sometimes to just go to the doctor and get it done. It takes time out of our day, and maybe we've got to move things around and change it up a little bit. I'm saying to you, do it. You got to do it. Get that checkup. Get that look into things. And also, don't be ashamed to talk to people about this. I had to really make sure to figure out that this was not some moral misgiving that had me here. It's just the body I have. It's the body I'm going to live in. It's the body the good Lord said, this is how you're going to have to make your way in the world. And I am. And I am. And thank goodness I didn't end that prematurely. So again, accept the help. Get to the doctor. Ask your questions. Make sure those doctors get those questions asked, and accept this is the body that you have, and love the community that will come together around you to be supportive, to be helpful. And if you don't have that, I'm going to say this: find me, call me. I'll be community for you. Thank you so much for doing this. All the best, and be well.
Thank you, Dean, for joining us today and sharing your story and your positive message. I think
before I do that, I would like to acknowledge presence of Representative Kilcoyne. I'm grateful to him and his staff for joining us for this event. With unfortunate technical difficulties with the video, I would invite Dr. Mitchell Sokolov to comment. Dr. Sokolov is a chair of urology at University of Massachusetts School of Medicine. Mitch, please.
Awesome. Can you hear me okay, Faye?
Yes, yes. Thank you.
Perfect. Well, good morning, everyone. And first, I want to thank Dr. Stern and the organizers of this, the 12th Annual Prostate Cancer Awareness Day, for inviting me back to speak. I've been in Massachusetts 7 years. I've participated in 6 consecutive events, and I'm very privileged and honored to partake this year, especially as one of the few clinical urologists. I also want to acknowledge, if any of the legislatures are still on board, just how fortunate we are in Massachusetts to really have executive and legislative branches that are so committed to addressing and eradicating prostate cancer. I've been at state institutions in several different states, and the Commonwealth of Massachusetts is clearly unique and a wonderful place. As a practicing urologist specialized in prostate cancer, I was asked to provide a brief update today on advances in diagnostics and therapeutics for men with prostate cancer. And we're fortunate that a week or two ago was one of our major meetings called GU ASCO, where a lot of these topics were covered, and you always get the state of the art and the most modern and comprehensive approaches. So there are different areas that one can address. I want to start with therapeutics, basically treating men with prostate cancer. If we start with localized disease, meaning everything's contained, surgery and radiation are the standard of care for many of these patients, active surveillance being the alternative. Surgery and radiation are very effective when applied to the right patient. And really what advances in surgery and radiation have included have been focusing on preserving the very high cure rates while simultaneously minimizing the side effects. And every year you get new and new approaches or new and new manipulations to try to decrease urinary, bowel, sexual side effects. With surgery this year, Retsia sparing approach, still using robotic and laparoscopy, but the way you handle the tissues has made a huge sort of triumphant appearance on the screen, and different ways of radiotherapy, such as hypofractionation, has also come of age. So in terms of the localized treatments, same platforms, surgery and radiation, but better preservation of quality of life within that goal of truly eradicating the cancer. For prostate cancer, the challenge has always been in advanced or metastatic disease. These are the treatments that have really been limited over the decades. And the mainstay treatment we use of manipulating androgens goes back to the 1940s. Granted improvements on it, but as a basic platform for treatment, it's a 70-year-old technology, so to speak. The last couple of years, and especially this year, there have been tremendous advances in new treatments and new drugs. Very effective in prolonging remission in metastatic disease. A lot of this is due to a better understanding of how we're using our our current conventional treatments, but also the introduction of a whole new series of chemotherapeutic, hormonal manipulating, immune modulating, molecular targeting agents, all big terms, all big names, but what it means is a better way of using the human body to attack its own cancers. And that leads to the next and most exciting part, and what's most germane to AdMeTech and today, is the continued improvements of better understanding individualized or personalized treatment. There are wonderful advances in imaging studies, a better understanding of the genetics and the molecular makeup of tumors so that we can target very specific attributes. Now, really more than ever, we can use this combination of imaging and pathology to stratify the best treatments to the right patient, ensure that man is getting the most effective therapy based on really individual and unique characteristics of their tumors. There have been huge advancements in this, and this would be the field of precision diagnostics, which is something that Dr. Stern has really dedicated the last era of her life to, and it's getting very exciting because we're getting higher cure and remission rates, minimizing the negative impacts, and really getting the best treatment for an individual patient so they're really optimized in what they get. My last topic I want to bring on covers the awareness and access to the underserved populations of men at risk for prostate cancer. This is very apropos to me out here in Worcester. We have a very large African immigrant and a very large African American community, and the prostate cancer incidence and mortality out here is higher than other places within the state. Bringing awareness and access is an urgent issue. We've heard about it today in lots of different sources, but we really needs our full attention. And what's really frightening is that despite these advancements we've made, despite screening, early diagnosis, between last year and this year, the American Cancer Society is predicting a 29% increase in the incidence of prostate cancer. 29% increase from last year to this year, which is a terrifying number. And this number is unfortunately very applicable to underserved populations and African American men. Lots of reasons for this. There were the misguided changes in the preventive health task force recommendations that have been mentioned today. Screening patterns among many primary care physicians has been suboptimal. We've heard about that. COVID has limited access to primary care doctors and patients in general. And then there are the social and economic issues that limits a person's ability to access quality health care. And since the onset of the COVID-19 pandemic, these disparities have only worsened as appointments and treatments get postponed, as people become unemployed and don't have health insurance. The negative socioeconomic and health repercussions of this pandemic is definitely disproportionately affecting the underserved populations. And we see this quite commonly right now in Worcester, and even our own institution, UMass Memorial Healthcare and UMass Memorial Medical Center, are really tweaking our annual goals and objectives to focus on the surrounding population and our anchor message to improved treatment of it. Now, more than ever, so crucial that we focus on improving access, awareness, education for our underserved populations. There are significant social and political determinants of health that present access to healthcare. We need to address these. We need to improve health equity and address these health disparities that disproportionately impact these underserved and racial communities. And if these barriers are not addressed, there'll be greater incidence of prostate cancer, much more mortality, much more morbidity, health expenditures, and just a continued worse health outcomes for particularly African American men. So Faye, I hope that kind of covers the topics that you wanted me to. If not, I can add any comments, but that's sort of how I see things as a urologic oncologist out here in Worcester.
Thank you very much. It was perfect. It's very special for me to introduce Howard Goldstein. Howard could not join us today physically because he is unfortunately losing his battle with prostate cancer. And yet, typically of Howard, he sent his video in support of our cause. Can you please demonstrate Howard Goldstein's video?
My name's Howard Goldstein. I'm speaking today. My official capacity is as a representative of 1 in 40. 1 in 40 is a nonprofit. The mission of the nonprofit is to promote awareness of the BRCA mutation, also known as Braca. Um, Braca is an acronym for breast cancer. But in 2016, in a very well-known article in the New England Journal of Medicine, it was finally established somewhat conclusively that Braca is implicated in prostate cancer. And so the question of genetic testing is quite currently an important issue in prostate cancer care. So first of all, presence of a BRCA mutation has implications for treatment. There are certain drugs, I benefited from one of them, that specifically target that mutation. They're called PARP inhibitors. And actually, I got a great year and a half of stable disease out of it. So that's the good news about having the BRCA mutation. Unfortunately, BRCA mutations in prostate cancer also carry with it a more difficult prognosis. With BRCA genetic defect, prostate cancer tends to start earlier, younger, and the disease tends to be more aggressive. There are higher mortality rates, and I can testify from my own experience that there are certain drugs that are commonly used in treatments that don't work very well or at all for prostate cancer patients with BRCA mutations. So from my point of view, it's really important that anybody with a prostate cancer diagnosis, and by the way, I speak for myself, not really the organization, and certainly I'm not a doctor, but in my view, it's really important that any man who's being evaluated for prostate cancer get genetic testing. There's a number of reasons for that. Number one, for the man himself. In my particular case, I had many years of negative biopsies, even though my PSA was rising. And I think if I had known that I had the BRCA mutation, I would have been much more aggressive about getting more frequent biopsies. There are surgical biopsies that are more accurate than the standard biopsies that men get. And of course, when I was going through this in 2004 or 5, there was no awareness that BRCA was implicated in prostate cancer. The other issue about BRCA is that our children and our siblings could be carriers of the genetic defect. So from my point of view, it was a tremendous relief that none of my children nor my siblings were carriers of this defect. But the science of it is that they each had a 50% chance of being carriers of that defect. Now, what does BRCA do? What does it mean? The presence of the BRCA mutation increases your risk of having prostate cancer, number one. It also, just so to put it in some context, the BRCA gene is part of the DNA repair mechanisms that everybody has in their body. So if you have a damage to your DNA and it's caused by diet or radiation or lifestyle or God knows what else could damage your genes, in a fully functioning person with a fully functioning BRCA gene, the cells repair themselves. But if you have one of these defects, it doesn't repair itself, or it doesn't repair itself as well, which explains why you have a higher incidence of cancer and why the cancers, if they do develop, tend to be more aggressive and more lethal. So from my point of view, not every prostate cancer patient has the BRCA genetic defect, but if you're dealing with prostate cancer, or if there's prostate cancer in your family, or for that matter, if the females in your family, if there's breast cancer, ovarian cancer, it's something that should be investigated. Now, I want to talk a little bit about 1 in 40. That's an unusual name. The reason for the name of the organization is that 1 in 40 Ashkenazi Jews carry the BRCA mutation. The incidence in the general population, I've seen a couple of different numbers, either 1 in 500 or 1 in 1,000. So it's a pretty rare genetic defect in the general population, but 1 in 40 Ashkenazi Jews carry the defect. And Jews are not the only people who have BRCA mutations. In fact, at the last time I was at the prostate cancer awareness event, I was speaking with somebody from the Caribbean, and we figured out that, in fact, in the Caribbean, there's a higher incidence of BRCA, partly because especially after the Spanish Inquisition and at other times, there were pretty large migrations of Eastern European Jews to the Caribbean. And many of these people have no concept that they're even Jewish or have Jews in their history, but it's kind of infiltrated the genetic pool in any event. So it's important to note that you don't have to be Jewish to have the defect. If you're an Ashkenazi Jew, you should consider with your physician or a genetic counselor whether you should be tested or not. All of the major teaching hospitals in Boston have really robust genetic counseling departments, and you can have contact with them. If you're not from the Boston area, I would say any large size hospital could easily refer you to a genetic counselor, because it's a big decision. What do you do if you have BRCA? Well, most people are aware that there's preventive surgery, but that's not the only response to BRCA. You can have enhanced screening. There are additional tests. For example, women with BRCA can have breast MRIs in addition to mammograms. They can have them more frequently. For men, it might imply, if there hasn't been a prostate cancer diagnosis, that you would have certain screening tests, which you can discuss with your doctor. But it's an important bit of information. You know, one of the things that I ran into when I started my prostate cancer journey is that people say things to you like, and I've had even doctors say things to me like, well, if you have to have cancer, prostate cancer is not a bad one to have, and most men survive. And the truth is that many men with initial early treatment do live a normal lifespan, even with prostate cancer. But people die from prostate cancer. I became aware that the annual mortality from prostate cancer now exceeds that for breast cancer. And everybody in the audience knows, the kind of resources that are being used to battle prostate cancer are far less substantial than those that are employed for breast cancer. But it's not a competition. But the point being that prostate cancer is not a benign cancer. It's not a good cancer to have. And I've been lucky. I also feel I want to thank Faye Stern and AdMeTech. They've done a tremendous job of changing the standard of care in prostate cancer. When I was being diagnosed, the conventional wisdom was that MRIs don't diagnose prostate cancer, that the technology has improved and the awareness of it has improved. For me, if I had MRIs available to me at the time, my prostate cancer would have been diagnosed years earlier. I went through a period of several years where I had biopsies. They were all negative. My doctors all had big smiles on their faces and told me that I didn't have prostate cancer and that there were a lot of reasons why people have elevated PSAs. So I'm grateful for the work that's been done in imaging. My prostate cancer finally was diagnosed through an MRI. At the time, Bill DeWolf was chairman of the prostate urology department at Beth Israel, and they were the only place in town using MRIs, and they were able to visualize my tumor. It was in an odd place, and I could have had 100 of the conventional biopsies and they would have never detected it. But once he knew where it was, they were able to detect it, and I got treatment. I have to say, this is kind of an emotional issue for me. I've spoken before at this event. Last time was 2 years ago. At that time, I was on a clinical trial of an experimental PARP inhibitor. Since that time, PARP inhibitors have been approved for treatment. But alas, I'm at the end of my prostate cancer journey. I probably will not speak again at this meeting because I've decided to stop my treatments. I'm sort of run out of things to help me. I'm blessed with a doctor who cares about my quality of life, and the available treatments were just making me sick and were not helping me. I actually do believe that some of the difficulty I had with treatments was the result of my Braca mutation. I'll never be able to prove that, but I just say all that to highlight that, yes, men do die of prostate cancer. You should get genetic testing. And if you do, there'll be all kinds of treatments available to you. And perhaps more importantly, you'll be giving a gift to your siblings and your children. So on that note, I think I'll stop. Again, I'm grateful for AdMeTech and all of the good work that's been done to help men with prostate cancer. Thanks a lot.
Together, we can make sure that no man will be in a Howard position ever again, because prostate cancer is curable when detected early. It is a great pleasure for me to introduce our next speaker. It's Sam Salman, CEO of MIR Scientific. He will talk about strategic vision for liquid biopsy and clinical trial partnerships they have with Puerto Rico. I also would like to acknowledge presence of Mr. Jorge Galva, Executive Director of the Puerto Rico Health Insurance Administration, overseeing Medicaid and 1.5 million health plan members. Bill, if you can please demonstrate Sam's video.
Hello, my name is Sam Salman. I'm the chairman and CEO of MIR Scientific. I'm here with gratitude to Dr. Stern, the wonderful leadership of the Commonwealth, Massachusetts, and the dedicated healthcare professionals who are here as well. MIR Scientific has developed and is validating a disease management platform focused on cancers, including prostate cancers, that provides a highly accurate urine-based approach to assessing malignancy by measuring the molecular dynamics of non-coding RNAs derived from urinary exosomes. I'm here to talk about our company's focus on delivering positive impact by addressing the burden of disease on those who confront prostate cancer, as well as the significant population of age-eligible men who are currently not engaging on a preventative basis with the current standards of care. To do so, we have worked very closely with distinguished scientific and clinical leaders in urology to reimagine disease management and to ensure that the tools we're working to create and validate for clinical trials are in fact what are needed to improve outcomes, reduce costs, and improve health equity. Prostate cancer is in an unacceptable health equity crisis. At-risk populations and regions are stricken with overwhelming suffering, despite the skill, talent, dedication, and compassion of the urology community and their tireless efforts to confront these structural challenges. It is our goal to work as partners with healthcare stakeholders and leaders to address these challenges by partnering as a committed long-term member of regional health ecosystems by first validating our test on those affected populations and making our prostate test as impactfully available as possible. A partnership we're very proud to have commenced is with Puerto Rico. Puerto Rico is poised to regain its status as a source of innovation for healthcare. We're working with the government and members of their medical community to validate and implement our platform to alleviate disease burden substantially. Thank you very much.
Surviving prostate cancer is a daunting, traumatic experience.
Yo me di cuenta que los hombres teníamos un problema con cualquier cosa que sea del ombligo para abajo. Eso es secreto presidencial que no se puede tratar.
46 radiotherapy sessions. So the months that I spent in pain and in horror, seeing my body respond to this. So is there anything else that can be done?
Prostate cancer in males is a direct consequence of aging. And so as you get older, you will suffer from prostate cancer at some point in your life.
Tenemos un problema en Puerto Rico precisamente de falta de médicos y en el caso de los urólogos
es bastante dramático.
In Puerto Rico, we have about 90 urologists. So we have about 2.5 million people. That pretty much sets up a difficult situation with us urologists. So we have had an enormous increase in the prevalence of prostate cancer in Puerto Rico.
Puerto Rico is now the epicenter of a groundbreaking medical test trial, making prostate cancer a priority and introducing Mir Scientific Sentinel, a new, game-changing, cost-effective test for men that could substitute the traditional invasive tests for a simple urine sample.
Just urinate in a cup? I'm number one. Call me, I'm number one.
Puerto Rico is one of the few places in the world in which prostate cancer has truly wreaked havoc. It has affected men, their families, and society in general, and is doing so with an ever increasing tempo.
Imagine just one test that can give you the specificity of what the prognosis is. It was going to be a game changer.
This is why the test trial that Mir Scientific is conducting on the island is geared up to have a worldwide impact.
Estamos hablando en este momento de una prueba que te facilita la detección del cáncer como nunca antes en la historia se había visto.
I am happy and I'm hopeful that this will bring about a realization, the treatment and the diagnostics that people have to go through in order to ascertain if they have cancer or not will be more humane.
At the end of the day, this is the reason medicine research and innovation exists, to promote longer, healthier, and happier lives. The future looks brighter, and that is our vision and inspiration.
Hello, I think we've come to the end of our formal program and we are running very early. Cheryl, do you want to say a few words at the completion of the formal program before we'll switch to the
Again, want to thank Governor Baker, the administration, the legislature, both the House and the Senate, for their 12 years of commitment to AdMeTech's mission and their education and awareness program, and for giving us financial support for many years. And that today, despite the trials and tribulations of not being able to be in person due to the COVID pandemic, that so many legislators still took the time to let us know their commitment is unwavering. And it is through your dedication, Faye, and perseverance that this really important public health issue doesn't really get put on the back burner. So I want to thank you. I want to thank all of my former colleagues from the legislature. It's wonderful to see so many of them. It makes me miss them and miss being involved in public health at the state level. But know that I'm here and committed to the ongoing work of AdMeTech, and a great supporter and fan of yours.
Thank you so much. And right now we will proceed with the next part of the program, which is virtual presentations by our community partners and advocates. But before we will proceed, I would like to ask, does anyone have any questions to Dr. Sokolov as a prominent physician, to any other speakers? Okay, we have no questions, and we'll proceed with the next presentation, which is presentation by Tal Kimmel, Chief Strategy Officer of MIR Scientific. I always want to say MRI instead of MIR.
Yeah.
Chief Strategy Officer of MIR Scientific. If you can please have Tal's video.
Hello, my name is Tal Kimmel. I'm the Head of Business Development and Strategy for MIR Scientific, one of the sponsors of today's event. With appreciation to Dr. Stern for inviting us to speak, I'd like to share with you today some information about a revolutionary technology that MIR Scientific has developed and that we believe is set to revolutionize the standard of care for management of prostate cancer. MIR Scientific has developed a liquid biopsy urine test that's incredibly accurate, very comprehensive, and non-invasive. It's a simple urine test that can yield a lot of information on the patient's status. It will tell us from that single urine specimen if a patient has molecular evidence of prostate cancer. And for those patients who test positive for cancer, the test will then classify the risk severity of the disease and will classify the patients between low risk, intermediate risk, and high risk patients. It's really only the high risk patients that need to be treated for the disease. All other patients really need to be monitored actively for the disease, which our technology does as well. The test provides very clear and actionable information to the physicians and to the patients who are taking the test. The test yields very simple, 1 of 4 results. It will either identify patients with no molecular evidence of prostate cancer, and again, for those who test positive for prostate cancer, it will identify them as having low risk, intermediate risk, or high risk cancer. We'd like to think of that information as answering the questions that are on every patient's and physician's mind. Is cancer present? And if so, how bad is it and what is next? The vast majority of prostate cancer patients have what's referred to as an indolent, a low-risk disease. It's a localized disease that's progressing very, very slowly, likely to take many, many years to show any sort of symptoms. Those patients need to go into active surveillance and be monitored, and it is really only the high-risk patients that need to be getting a biopsy and moving into the definitive care paradigm. The test itself is incredibly accurate. We're talking about accuracy levels in the 90s percentiles for both sensitivity and specificity, which essentially means that hardly any cancers are ever missed and hardly any cancers are misclassified, nor will it identify falsely healthy patients as having prostate cancer, which is a big problem with the current standard of care. The company received multiple validations for the technology, including a recent publication in the peer-reviewed Journal of Urology. And I'm pleased to announce that back in October of 2020, the company also received the highly coveted designation of breakthrough technology from the Food and Drug Administration, putting us on a path for expedited review and hopefully approval, and with it also broad reimbursement coverage for the technology. We believe that given the option between going into the definitive care paradigm or the current standard of care involving a very invasive prostate biopsies, or simply giving a urine specimen, which will yield, according to our studies, much more accurate information, the choice is going to be very, very clear. Please be on the lookout for commercialization announcements later this year. The test is expected to be available commercially later this year as an LDT, as a lab-developed test. We'll be selling it out of our CLIA and or CLEP approved labs, which are expected in the coming months. Thank you again, and we hope to continue our presence here at the conference. Thank you.
Okay, it is a pleasure for me to introduce Dr. Bella Dinas, who is Vice President, Global Medical Affairs at Lantheus Medical Imaging. Lantheus Progenics have been leading the world in molecular imaging of prostate cancer.
Hi, Faye. I'm hoping you can see and hear me.
Yes.
Okay. Again, congratulations on again putting together a very meaningful, important, and informative program. I understand that you guys are in Massachusetts, so I want to send my best from the West Coast as I am calling in from my home in Southern Oregon. Now, I am going to attempt to share my screen. Let me know if you can see my screen.
Yes, we can see it.
Okay, and I'm going to the presentation mode. So again, actually the introduction from the previous presenter was very meaningful because I want to talk about some of those very concepts that were mentioned. And what I want to talk about is, why PSMA? Because we need to move beyond PSA. As a personal disclosure, I'm Vice President of Medical Affairs at Lantheus Medical Imaging. I am a urologist by training, and I've have been involved with prostate cancer from direct patient care to drug development, device development, molecular imaging, and molecular tissue diagnostics throughout my life. So I don't think there's a man alive today in the US that's not familiar with PSA. It's almost part of our lexicon now. And PSA is used in two settings. The first setting, of course, is screening men for prostate cancer. In other words, taking a man who is asymptomatic and running a test to see if he's at risk or if he actually has prostate cancer, and conversely, if he is disease-free. So the problem with PSA, as everybody knows, is that it has a high sensitivity. In other words, the ability to identify men with prostate cancer, but a very low positive predictive value. In other words, the percentage of men who have a positive test who actually have prostate cancer is low, and therefore a lot of men undergo biopsies and MRIs and additional testing to try to sort out who's got what. On the flip side, it has low specificity. In other words, its ability to identify men as disease-free, but a very high negative predictive value. In other words, the percent of men with a negative test who actually do not have prostate cancer. The ideal test, as was referenced by the previous speaker, should have high sensitivity and high specificity, which in turn translates into high positive predictive value and a high negative predictive value. So you could actually predict who's got what. Now, in the disease monitoring setting, PSA is an incredibly accurate tool. It is an incredibly useful tool because in the monitoring setting, in other words, once you've had treatment, it has very high sensitivity and high specificity, a high positive predictive value and a high negative predictive value. In other words, if a man has had a radical prostatectomy and the PSA is undetectable and continues to be undetectable, the negative predictive value is essentially 100%, that man no longer harbors prostate cancer. However, the flip side, if you've had a radical prostatectomy and all of a sudden your PSA starts to rise, even if it's as low as 0.1, 0.2, 0.3, that's a high predictive value that there is disease, because virtually no other condition other than recurrent prostate cancer will cause a rise. So, but what's the problem? If we can identify men who have recurrent disease, what's the issue with prostate cancer? Well, the problem is it's a blood test. So it cannot identify the location or the extent of the recurrence. And since you don't know where it's coming from, it's very hard or impossible to provide targeted, individualized therapy. So to address the unmet need in prostate cancer in initial staging, one of the issues is that, as Dr. Sokolov has mentioned, is that surgery and radiation have undergone tremendous refinement in our lifetime. Yet today, 50%, up to 50% of men undergoing either surgery or radiation with curative intent will have a recurrence of their cancer based on PSA recurrence within 5 years. So is it because our surgery is ineffective, we don't know what we're doing, or is the radiation ineffective? Or is it, as Dr. Sokolov indicated, do we need to select patients better? Do we need more information before we recommend either surgery or radiation? That's in the primary setting. In the recurrent setting, the issue is what I mentioned before, is that when a patient comes to Dr. Sokoloff or to me and says, you know, my PSA is coming back, where is it coming from? Where is the disease? I thought I underwent a curative procedure. Conventional imaging with CT, MRI, bone scan simply doesn't have the sensitivity to detect the location or the extent of the recurrence. So we need better tools. And what is that better tool? It's PSMA, and PSMA molecular imaging, or PET imaging, for prostate cancer. In this cartoon, you see a prostate cancer cell, and in the benign prostate or the normal cancer cell, PSMA proteins are internal to the cell. But for some reason that we don't fully understand, when the cell undergoes malignant transformation, this protein translocates to the outside of the cell. It's on the cell surface membrane, and therefore it becomes a great target to be able to image and also to potentially down the road treat. Again, you know, this may look a little bit familiar to those in the audience, to the so-called spike protein that has been the target of the COVID-19 vaccines, and it acts in very much the same way. So by knowing that this protein is expressed on the cell surface, you can develop an agent that will bind to it, give off radioactivity that can be imaged on a PET scanner, and also additionally, you will see the availability of targeted radioactive treatments that will bind to these proteins, and then the radioactivity attached to that molecule will actually destroy or kill the cell. So they say a picture's worth 1,000 words, so I'm going to finish up by presenting two cases to show you not only what it is, but why PSMA PET will have such a prominent role in both the initial staging as well as the management of men with recurrent disease. This is a 63-year-old patient whose PSA was 13.8. This is his MRI, and what you see here is an extensive prostate cancer lesion, primarily on the left side of the prostate. He had underwent prostate biopsy, and the majority of the course, 13 out of 16, were positive for a Gleason 9 cancer. That is a very high-risk prostate cancer. It's high volume, high risk, but it appears localized on MRI, and conventional imaging with bone scan, which you see here, is also normal. This is a totally negative bone scan with a patient with extensive Gleason 9 prostate cancer. So conventional recommendation would either be surgery or radiation to the gland. But if you do a PSMA scan, what it shows is, despite the negative bone scan, he has extensive metastatic disease throughout his body, in lymph nodes and in bone. All of these dark spots that you see here are metastatic deposits of prostate cancer. So it would not be surprising if this patient underwent radical prostatectomy or had curative radiation, that in his follow-up visit, his PSA would rapidly recur. Again, it's not a failure of the primary therapy. It's a failure of choosing the right patient because you didn't have you weren't aware of the full extent of the disease. So this is an image of a patient who had where PSMA offers great utility at initial staging. In the recurrent setting, this is a 63-year-old patient who had undergone a radical prostatectomy some time ago and now has biochemical recurrence with a PSA of 3. CT and bone scan, again, completely negative. So when it comes to offering treatment, it's very difficult for the urologist or the medical oncologist to prescribe accurate treatment because you don't know where the disease is. So he underwent a fluciclovine PET scan, which is approved for imaging in recurrent prostate cancer, and that scan is negative. He also had a gallium PSMA scan, which now shows up that there are some suspicious nodal deposits here in the pelvis, but then he underwent the DCF-PYL scan, which Lantheus has received priority review from the FDA, and we expect to have commercially available in the second half of this year. And this scan is so sensitive that it shows up multiple areas of deposits. So it allows you to target this with targeted radiation, again, still with potential cure, as there's no widespread or distant disease present. So I hope these two examples have demonstrated to you how the potential utility of this new scan that should be available, both in the initial staging as well as the recurrence setting, if the FDA grants us approval at their review at the end of May. And you will certainly be seeing and hearing much more about this scan. So again, being on the West Coast, I will close with a quote from one of the surf dudes out on the West Coast. And the question is, why PSMA? Because the more you know, the less you need. Thank you very much. And I'm happy to answer any questions.
Thank you so much, Dr. Dennis. Is there any questions? I don't see anybody raising their hand or putting something in the chat. So I'm going to thank you for joining us for this important annual Prostate Cancer Awareness Day in the state of Massachusetts, and for the work that you're doing that's helping to further improve prostate cancer diagnosis and treatment for men.
Thank you again for the opportunity. And Faye, again, congratulations on a great program.
Thank you so much, Bella. Thank you. Thank you for the incredible work you've been doing for years.
Yeah. And next we have a presentation from Christy Rodriguez from the Latino Health Insurance Program, serving Hispanic, Portuguese, and African American communities across the state of Massachusetts. And I believe we have a video with Christy's presentation.
Hello, I want to give a warm welcome to everyone tuning in today to the 12th Annual Prostate Cancer Awareness Day. I hope everyone is doing well. First, I want to give a big thanks to Dr. Stern and everyone at the AdMeTech Foundation for allowing me to speak about our program today. My name is Christy Torres Rodriguez. I am the Patient Navigator Coordinator for the Latino Health Insurance Program. The Latino Health Insurance Program is a community-based organization that has been operating for the last 15 years, providing services to Latinx families in Massachusetts in English, Spanish, and Portuguese. LHIP is a nonprofit organization with 3 primary goals: to offer a community-based, culturally specific program for health insurance enrollment and maintenance to minority residents in Massachusetts, to connect clients to the appropriate healthcare services, including primary care, dental care, and specialty care, and to promote a more effective use of preventive services, including health screenings, prenatal care, wellness visits, and health education, while reducing medical costs. LHIP has served more than 80,000 Latinx families in Massachusetts from racially ethnic minorities and mostly from Hispanic and Brazilian origin, with high positive COVID-19 cases. We work very closely with the Department of Transitional Assistance to assist families to apply for SNAP and cash assistance programs. We are a benefit enrollment center where we help seniors enroll to medical coverage, apply for SNAP, extra help, and medical security program. We help families apply for the emergency assistance income payment program and rental assistance programs from the city of Framingham. We are currently providing virtual checks via telephone and telehealth, where providers speak with participants to determine whether or not they fit the criteria to be screened, to be tested for COVID-19, if they need an office visit, or referral to a patient navigator to assist with any of these services. Individuals with COVID-19 have been found with multiple comorbidities, such as uncontrolled diabetes, hypertension, with a high, which have a high prevalence in the Latinx population. LHIP's efforts are also to provide virtual health education for people from these communities and to prevent these diseases from happening, provide reduction of social isolation, and educate the participants on how to manage and control these conditions to reduce complications associated with these diseases. LHIP has a licensed clinic and certified diabetes educators, as well as a wellness center. We have served as a link to many families with COVID-19 to apply for many of these services, including Medicaid, unemployment, fuel assistance, rental assistance, food assistance programs. An example of the success of LHIP's latest efforts include helping a family communicate to the Board of Health their positive COVID-19 diagnosis. The Board of Health had identified 2 cases at a residence. When LHIP intervened, we identified 14 individuals living at this residence with COVID-19. We were able to provide assistance for these families to bring food to the table to their families during this very difficult time, as well as rental assistance. We will continue to help these vulnerable families during the pandemic and after. Our main office is located in Framingham. We are at 88 Waverly Street in Framingham, Massachusetts. You can call us at 508-875-1237 or visit our website at lhiprogram.org. Our main email is help@lhiprogram.org. We will be here to help all families in need. Have a nice day.
Thank you. Thank you for that information and for the work you do to support individuals and their families. That's so critical often in making sure people have access to healthcare at some of those wraparound support services that really help promote better health. And next we have a presentation from Maria Gonzalez from Healthcare for All. Happy to hear from Maria today. Maria is a former colleague of mine from the Department of Public Health, and I know she's doing great work on health equity with Healthcare for All. So thank you, Maria.
Hello, everybody. My name is Maria Gonzalez Albuquerque, and I am the Director of Communications in Immigrant Health at the nonprofit organization Healthcare for All. Healthcare for All is a nonprofit organization based in Boston, statewide, that serves Massachusetts consumers. We advocate for health justice by promoting health equity and ensuring access to coverage and care for all the residents in Massachusetts. I'm here because I have a lot of information to share with all of you. The most important piece of my information that I want to tell you today is that people need to have health insurance, not just in Massachusetts, across the country, but it's very important for residents to have access to health insurance that covers their health services, their treatment, and so forth. In Massachusetts, we have many plans for residents of the state, for low-income consumers as well. Massachusetts has programs for people who are undocumented, people who have different immigration statuses, people who have different income levels, and so forth. One thing that you can do to understand if you can qualify for different programs is to call the Healthcare for All helpline. We have helpline counselors that speak English, Spanish, and Portuguese and can help you navigate the healthcare system. They can help you apply for health insurance, and they can help you also answer any questions that you have. You need to call 800-272-4232. Once again, 800-272-4232. This is a great resource for everybody in the community to call our helpline when they have questions about what kind of programs they may qualify for, what kind of services are covered by their insurance, and so forth. Right now, it's very important for people to know that our Health Connector, which is our state-based marketplace under the Affordable Care Act, Obamacare, is going through open enrollment. Open enrollment has been postponed, has been extended through May 23rd, 2021 due to the pandemic. So we want people to try to apply for coverage. If they don't have coverage, if they want to change their plan, they can use open enrollment to do that. They can call our helpline number to go through this process to see if they qualify for Health Connector coverage. But it's also important for people to know that open enrollment has been postponed, has been extended through May 23rd, 2021 due to the pandemic. So we want people to try to apply for coverage. If they don't have coverage, if they want to change their plan, they can use open enrollment to do that. They can call our helpline number to go through this process to see if they qualify for Health Connector coverage. But it's also important for people to know that if they qualify for other programs, such as Health Safety Net, if they qualify for Mass Health, or if they qualify because of their income, for a program called Connector Care, they don't have to do this process during open enrollment. There's no open enrollment. It's an open time of the year that they can do at any point. Is an ongoing enrollment that they can do. But the most important thing to understand what a person qualifies for is to really call the Healthcare for All helpline. I'm here to also talk about other things that we do at Healthcare for All. We have a project that I lead on immigrant health, and we want to ensure that people who are immigrants understand that they have rights to access coverage and care in Massachusetts, that that information is private and confidential, that they are entitled to use services if they are sick, that depending on their immigration status and their income level, they're gonna qualify for different programs. And the health insurance for most people does not count towards what's called the public charge rule, which is a public charge rule is a test that immigrants have to overcome in order to apply, in order to become permanent residents. That is very important information. They can call our helpline if they have questions about their immigration status as they relates to public charge and health insurance. So once again, 800-272-4232. We also do a lot more work. We want to expand access to oral health services. We want to lower the cost of prescription drugs, make care more affordable. We want to expand access for maternal health services. We want to really understand social determinants of health and how they impact people. There's so many campaigns and so many things that we're doing. And if you want more information, you can visit www.hcfama.org. Once again, hcfama.org, hicfama.org. And there you have a lot of the information. Feel free to reach out to me, mgonzalez@hicfama.org, mgonzalez, MGONZALEZ @hcfama.org. Thank you.
Thank you, Maria, and thank you to Healthcare for All for their continued advocacy to make sure people have access to health coverage so that in fact they can get these important health services. We know that without access to health insurance, people don't see the doctor and don't get some of the screenings that they need. And I think throughout the day today, we've heard from experts who really reinforce the importance of early detection, early intervention for the best outcomes for men with prostate cancer. So Healthcare for All, thank you for increasing access for everyone here in the Commonwealth and protecting people with immigrant status. Very important. They also fear sometimes going to see a provider for what some of the repercussions might be to their immigration status. So great work, Maria and the team at Healthcare for All. And I think we are coming to our last presentation today. We have Kate Gibbons, who is the we have two more, sorry. Manager of Patient Programs and Education, Zero, the End of Prostate Cancer. Those are great words to be thinking about, the end of prostate cancer, but at least we can be moving in the right direction from all of what we've learned today. So can we have Kate's video, please?
Hi, everyone. Thank you so much for having me. My name is Kate Gibbons, and I'm the Patient Programs and Education Manager at Zero, the End of Prostate Cancer. I am thrilled to be a part of the 12th Annual Prostate Cancer Awareness Day, and I'm very excited to spend the next few minutes discussing Zero and sharing with you some information about the array of patient and caregiver support programs that we offer. So Zero, the End of Prostate Cancer is actually the leading national nonprofit with the mission to end prostate cancer. We work to advance research, we work to inspire action, and we work to really improve the lives of men and families. So let's go ahead and jump right into our programs and our educational opportunities that are all offered at no cost. First, I want to talk about our 0360 program. So 0360 is our comprehensive patient support program. This program really provides that one-on-one personalized navigation of the prostate cancer journey for prostate cancer patients, as well as their family members and loved ones. This is done with the support of trained case managers. So we utilize those trained case managers pulling on their knowledge, pulling on their experience, and really pulling on their database of resources. So our 0360 case managers can help with things like finding a second opinion, insurance navigation, understanding benefits, whether that be disability, Social Security, and applying for those benefits. They can also help locate emotional support resources and also connect patients and families with much needed financial assistance resources. And these financial assistance resources could be for things like medical bills, and they can also be for things like daily cost of living expenses. So whether that's food, that's transportation, it's rent, mortgage, electricity, our case managers are really there to help. And one of the neat things about this particular program is that those case managers are really with patients and their loved ones every single step of the way. And what I mean by this is that they are making the calls with patients. So they can be on the line if a patient needs to talk to a mortgage company and negotiate a lower rate. They can be on the line if they have questions about copays and insurance with the insurance company. And this is all to make the patient the most confident and most comfortable, because prostate cancer diagnosis can be very overwhelming. And to be able to have somebody there that knows how to ask these questions and which questions to ask is very valuable. And that's what our case managers are there for. And since the beginning of our program, we've actually been able to help over 2,100 patients and families and help obtain over $2.7 million in debt relief for those patients and their families. Next, I want to touch on Zero's peer-to-peer support programs. So we've heard from many people on the prostate cancer journey that really talking with someone who's walked in their shoes is really invaluable and a really supportive aspect of this entire prostate cancer journey. So because of that, we created 2 one-on-one support programs. So we offer one-on-one support for patients through our mentor program and one-on-one support for caregivers through our caregiver connector program. So in our mentor program, we pair patients with prostate cancer survivors. And these prostate cancer survivors are our mentors, and they are trained volunteers. And we're actually able to make these matches and make these connections as closely as possible based on a man's diagnosis, based on their treatment, based on their stage, their side effects, just really being able to tailor that relationship and tailor that match to whatever the patient is looking to discuss. Now, the Caregiver Connector program is similar to that in that it is peer-to-peer support, but it's for those that are currently caring for somebody with prostate cancer or who have lost someone to this disease. So the Caregiver Connector program pairs caregivers with those that have been in the same or similar position. So Zero's volunteer caregiver mentors have cared for their brothers, they've cared for their fathers, their husbands, their partners, their sons, their grandfathers, friends, neighbors, and they're all trained to support other caregivers by really pulling on and offering their experience and insights. Next, I want to talk about Zero Connect. So Zero Connect is actually our online support community. It is Facebook-based, where those that are affected by prostate cancer can share their stories, they can ask questions, they can connect with one another, everybody on their prostate cancer journey. So it's actually a community of about 2,700 prostate cancer patients. It's survivors, caregivers, family members, loved ones, and friends who really all come together to support one another in the face of this disease, really getting their questions answered and really finding support in one another. So in addition to our programs, we also have a number of webinars and educational tools for patients and their families to learn from throughout their prostate cancer journey and beyond. So one in particular that I'd love to highlight is our upcoming Zero Summit. So this year, our summit is a virtual conference that brings together experts, it brings together patients, caregivers, family members, and professionals from all over the country and even beyond this year to learn and to advocate together. So this year, actually, our mission speaker is Cal Ripken Jr., and our summit will be taking place February 28th to March 4th. So we hope that you'll join us from the comfort of your own home and tune in and interact, support, and advocate the prostate cancer community. So in summary, to learn more about all of our programs, to get connected to a 0360 case manager, to get matched with a mentor, to become a part of Zero Connect, or to check out our educational tools, and especially to sign up for our upcoming summit, please visit us at zerocancer.org. Thank you so much.
Thank you for sharing that information, and the summit sounds pretty exciting. That's actually just a few days away, I guess. So our final presentation is from Allison O'Hara, the Executive Director of 1 in 40. We heard a little bit about 1 in 40 from Howard in his presentation today. And so I think this will help us get a better sense of what 1 in 40 is trying to accomplish. So Allison.
Good afternoon. I hope everyone is doing well. Before I begin, I just wanted to thank AdMeTech Foundation and the Prostate Action Council for inviting us to speak today at the 12th Annual Prostate Cancer Awareness Day. So thank you so very much. My name is Allison O'Hara. I am the Executive Director for 1 in 40. For more information on 1 in 40, you could visit our website at www.1in40.org. I just wanted to share a little bit more about why 1 in 40. In 2016, our dear founder, Lauren Kordock, sought genetic testing and counseling. The screening showed that she inherited a Braca, inherited a mutation in her Braca gene from her father, putting her at much higher risk than the general population of developing breast and ovarian cancer. The general population has a risk of about 1 in 400. She was advised to have risk-reducing surgery, but it was too late. She already had stage 4 ovarian cancer. Given Lauren's family history of breast cancer and her Ashkenazi Jewish heritage, she should have been referred to a genetic counselor and screened for the Braca gene mutation many years ago. Lauren knew she had to do something to raise awareness to others and help those facing the same journey and to save other lives. 1 in 40 was born. Unfortunately, Lauren passed away just recently in late December from her courageous fight with ovarian cancer. Lauren was an amazing person, a dear friend of mine. She was a brilliant leader, a voice, and an advocate for all of those impacted by hereditary cancers. As we mourn her loss here at 1 in 40, we're committed more than ever to our life-saving mission and the important work we started. Just a little bit more about 1 in 40 and what we do. 1 in 40 is a nonprofit organization that raises awareness of the 1 in 40 risk to Ashkenazi Jews of inheriting Braca gene mutations and provides the support individuals and families need to effectively manage their cancer risk. So just more about how we accomplish our mission. We hold monthly educational webinars that are free of charge to the community, which features experts and speakers covering topics on Braca, genes, genetic counseling, testing, as well as featuring 1 in 40 storytellers who share their own personal cancer journeys or how cancer has impacted the lives of the ones they love. In addition to that, we also offer medical education webinars. As we have learned, most physicians are unaware of the 1 in 40 risk. We advocate for healthcare reform. We raise awareness and provide emotional support to help individuals and families process and face their cancer risk and make sound personal decisions to mitigate that risk. Since our inception in 2017, we built a national network of cancer centers, nonprofit organizations, and synagogues, or I should say we've partnered, position ourselves as a leader in the field of Braca gene mutations, and reach thousands with our life-saving messages. A little bit more about BRCA. I'm not a medical professional, but very briefly, everyone has Braca genes, BRCA1 and BRCA2. Those are two of the most well-known genes that can mutate and raise risk of breast cancer, whether that's female or male, and or ovarian and or prostate cancers. Women who inherit a mutation in either of these genes from their mothers or their fathers have a much higher than average risk of developing breast and or ovarian cancer. Men with these mutations have an increased risk of breast cancer, especially if the BRCA2 gene is effective, and potentially prostate cancer. So what can you do? We encourage you to attend events like this today. Encourage you to visit our website for more information on hereditary cancers, including prostate cancer. That's 1in40.org. We encourage you to speak with your doctor to learn more about your family's health history and to have a conversation about potentially, getting screened or to talk further about genetic counseling and testing. I also hope that everyone who's listening, even if those of you who don't have a family history of BRCA cancers, talk to your family and loved ones to learn more about your ancestry and your family's health history. We also encourage you to attend one of our upcoming webinars, sign up for our e-newsletter, and visit our website for more information. Once again, here are some additional resources. Our website to learn more about genetic counselors, about geneticcounselors.com, and to get a listing of the National Society of Genetic Counselors, that's nsgc.org, to find a genetic counselor. Once again, thank you for inviting us this afternoon. We greatly appreciate all the work that you are doing. And once again, encourage you to visit our website at www.1in40.org. Thank you.
Thank you, Allison. And I'm happy to say that that concludes our presentations. And I think if there is anybody still on the line that wants to ask a question, we welcome any questions or comments, and do want to thank you all for your attention today and for participating, and to AdMeTech for all of their technical support and putting this together. It's, I guess, that one of the silver linings of the COVID pandemic is that we've all become more technologically savvy, and we can do more things from greater distances together. And hopefully that doesn't replace our human interactions going forward, but that it augments our abilities to learn from each other despite our distances. So, Faye, I don't know if you have any concluding remarks you'd like to add.
I really want to thank you, Cheryl, for being an indispensable master of ceremony for this event for so many years. I cannot even remember.
I know.
Thank you so much. A long time. Thank you so much. It's been the first virtual Prostate Cancer Awareness Day, and we learned a lot today on many levels. I do want to thank everyone who participated in this event, everyone who have been participating in this event for many years, like Cheryl. And I hope to see you next year in person at the Great Staircase at the State House or in the Great Hall. Thank you very much for all of your work. Thank you very much for your dedication. Thank you for sharing your stories, because between research, education, public awareness, and personal dedication of survivors, that's what will make it possible for us to end prostate cancer crisis together. Thank you so much for your attention and have a great day.
Thank you.